We're live, brother.
Are we live? Okay. Hey, this is it, man. This is the inaugural episode.
This is the one.
This is the one. Welcome to the Vitality Code, everyone. I'm your co-host, Dr. Jason Farrah, and I have my esteemed co-host, mi hermano, Dr. Jeff Farrah. Jeff, you want to introduce yourself?
Yeah, I just tell people I may not be the academically as esteemed brother, but I'm definitely the better bearded brother.
You're the face of the operation.
That's right. You're the brains, I'm the face. That's true.
You're the brain. So yeah, guys. So what we decided to do is kind of take our shared experience in the world of healthcare, and it's a comprehensive one, as you'll find out. And we both have comprehensive kind of multidisciplinary medical practices in our respective states. And we said, let's get to know each other. Let's get to know our audience, and let's share what we've learned as healthcare practitioners in various ways over the years, and bring it to you guys, and let's explore that together. And I think there's a lot to cover, a lot of ground to cover here between the two of us. And that's the purpose of this. And, understand health and vitality as we age, how to become healthy, how to maintain that. So without further ado, I got into this because of Jeff, so I'm going to blame it on him. What do you recall of our origin story? What do you recall of
Well, I was thinking about that as we were getting ready. This is like the first episode, the origin, and I was thinking, let's dive right into it, right? Let's talk about some vitality concepts. Let's talk about some things that are really important to the patient. Let's talk about how we age. Let's talk about how we slow that process. And then I said, whoa, slow down just a little bit, right? We need to, for the sake of the audience, for the sake of the people watching, but more so for the sake of us, I thought, let's start at the origin story of each other. I started to think about it. Yeah, we're brothers, so we grew up together in the same house. So we obviously have a history. We obviously have some connection. We obviously understand each other and where we've come and where we're going. But as I started to think about that concept, we've been apart, so to speak, longer than we actually lived together. Yeah. And so I said, well, let's just get the origin story from the origin. Let's find out. And so I was like, I really want to know maybe some questions I haven't asked. If I was a member of the audience, I would like to know about you and how you got into this. I would like to know how you came about your current thought process. I would like to know some of the guiding factors and influences, whether they be experiences, whether they be mentors, whether it be the formal educations that brought you to the point that you're at. And so I said, well, if it's the Origin podcast, let's dive into the origin. And I thought, if you're okay with it, let's go right to your origin story in medicine.
Let's do it, man. Absolutely. Yeah. I'm ready.
So
what you got for me?
From what I remember, and that memory is a tricky word, but from what I remember, I wanted to start at the genesis of your formal education, right? There's always the past that influence where we are currently in terms of our childhood or in terms of our parents and things like that. But I wanted to start at FSU, Florida State University. You were in the inaugural admission class, and that was your first formal step into this world of medicine. But as I remember, correct me if I'm wrong, you were a lit major. An English major, an English lit major, and then you went to med school. And I remember thinking okay, this is different. I didn't see the MCAT coming. So give us a little insight how that happened.
Yeah. You remember as we were growing up. So I still remember that famous picture where we're both on crutches. I think it was like your left leg, my right leg.
My kids were just talking about that the other day. That's funny.
Oh, were they really?
Yes, I think somehow it came across. I don't remember.
So we had this injury 1 week apart. I think I was skimboarding, and you.
Yep.
Oh, yours was football practice.
Football practice, and you were skimboarding on the beach.
A week apart, we broke our ankles simultaneously, but on the opposite foot. And I think it was that orthopedic. And it's interesting now that I'm a double board certified trauma surgeon. I guess I was always in this world of injury through my own clumsiness, I guess, and helping other people with but that acute setting, I got to know an orthopedic an orthopedist, orthopedic surgeons, and I think that's how I got interested. And a lot of people have this, right? They get injured or they have some kind of illness, and it kind of piques their interest. And so it was at the right time, right when I was finishing high school and thinking about college. And I said, let me explore this a little further. Started kind of shadowing a physician, and
was that Dr. Stowers?
Yeah, Chris Stowers.
Oh wow, he's still practicing, by the way.
What's that?
Still practicing.
Oh my gosh, yeah. He always called himself. He was a pseudopod. He was a sports medicine doctor. wasn't quite an orthopedic surgeon, but did a lot of the other sports medicine stuff. And
he was the only, as I remember it, and maybe still, but I think they've grown so much. He was the only non-surgical orthopedist in that surgical group.
Yeah.
So he was the one that you went to if you weren't going to get cut on.
That's right. And then I ended up getting surgery later on my knee for a separate injury. And I said, this is pretty neat. I shadowed some of the surgeons, corresponding with the time I was graduating high school, going to undergrad, and wanted to get involved in that, wanted to help people. Remembered what it meant to me because it was a scary thing. And, doctors, they know everything. And this was the thing, Jeff, was like, doctors, they know everything. I want to know that. I want to help people. And as you and I both know, I don't know. What we don't know is probably more than what we actually know. Now, I would never take anything away from allopathic medicine. There's been a lot of big discoveries. I'm not here to rag on it or anything. I'm a member of that community. You're a member of that community. But so, I had an interest. I found out I didn't have to have a biology major. I don't know. But maybe when I was in undergrad, I thought I wanted to explore these other
Edgar Allan Poe. You were going to be
I wanted to be some kind of poet, scientist. I don't know. And they said, yeah, you can do that. You just make sure you take the necessary classes. So I did that, matriculated onto med school, and from there went on to residency at Wake Forest.
So was the goal? Do you think the goal was always to go to med school as a lit major, or were you potentially but were you potentially maybe avoiding, I don't want to say your destiny, but what your path was to be or should be, or was the intention to always be a multi-faceted, educated? Because I think the lit major in a lot of ways, and I'll speak to this later, has helped you in your career. But was that the intention, or was that just like just how it happened?
Cool. Wow, that's a tough one. Yeah, maybe. I mean, I think in those formative years, right? You and I both have kids, right? And we each have 3 kids, and you think, I mean, potentially, yeah. I mean, I think there's what does your family expect of you, right? And then there's what do you want to do and what's viable, and I think sometimes those things are hard to figure out. So maybe it was also. I mean, I was genuinely curious about literature. I liked it. You and I always, growing up, we were always reading, as I recall. And
readers are leaders, brother. Readers are leaders.
Readers are leaders. Nick, I
little inside joke there.
Yeah, readers are leaders. I guess it worked out.
Yeah.
And so I don't recall consciously. Well, maybe a little bit. But was more so. I think as I went along, was more so. Hey, this is something I could do. Is my last chance to do it. Before I knew there was a long road ahead of me. I was not naive in that sense. I think I underestimated it. But
med school in general, you mean?
Oh yeah.
For sure.
Pathological physician.
Don't you? I mean, doesn't everybody that age? I think though, as I look back at your career, I think one of the things I've admired of you as a surgeon is your ability to articulate, your ability to have a good bedside manner, your ability to bring yourself to the patient's level in a verbiage that is not speaking above them. And I think that probably is in no small part to your undergraduate degree in English Lit, right? You were, to an undergrad level, were required to master the English language in a sense that you wouldn't have been if you were a biology major, to a sense that you would not have been if you were a chemistry major. So you were forced to focus on these things that made you, I think, in the long run, a much better physician from a surgeon standpoint, but also if you had gone into anything as a physician, because we all know one of the things that is really lacking, I think, in the medical community is the ability to communicate to a patient, especially from a surgeon, right? You're trained to dive deeply into this realm of the physiological, the structure. That you can't be a poet and a neuroscientist. Those are really tough opposites. But in a certain sense, you achieve that to a certain degree. So I think it has been a blessing for you, whether you realize it or not.
Oh, hey, and I promise, Nick, we didn't, we didn't, I didn't pay him to say that. Thank
Yeah.
you. No, I think, yeah. So what, it was definitely that right brain, left brain integration, right? I
Sure.
mean, and that, so there's an intelligence quotient component of anything in life. And then, but as I think what we're seeing now is more and more that EQ, that emotional quotient. Yeah. So I think that helped me develop an emotional intelligence to connect with patients, look
Sure.
deeper into patients' real issues, read between the lines, understand the subtext. Absolutely. Because there's always those thematic things that you're addressing in the literature. What you're reading on the page. There's also a theme that the author is trying to get. What's the protagonist maybe I don't know, in the case of like Oliver Twist, it might be in a boys' home, right? But what are the deeper themes? And so I think that it helped me with it. Patients, they might it might come in as a trauma patient, but what are the deeper themes that they're dealing with? And then we see that now in our practice, right? Big time in the world of hormone optimization, wellness, and everything. What are these deeper themes that people are addressing in their lives? So I think it did help me to a large degree, and I'm glad for that. Yeah,
I agree with
that.
So you graduate with a lit degree, English lit. You take the MCAT, probably a very daunting task, and then you step foot into the inaugural admission at Florida State University. Give us a snapshot of that wake up call that you got when you walked into that first week of med school, that first month of med school. Like, what was that like?
Well, that was tough, right? I mean, and this was a theme now, and I think about this throughout probably both our lives, is this entrepreneurial spirit. I don't know where we got that from, maybe our parents. But we were always starting, we were always doing these things where we're starting from scratch. Right. And so you're at FSU, we were paradigm breakers. They had a class or a new setup about, going into the community, getting your clinical rotations in the community rather than in a hospital-based system. And then also kind of you have to have that maverick spirit of being able to swim upstream, taking on the challenge of a new med school, and at the same time.
But is that your perspective now, or was that your perspective then? Tell me what your perspective then was. Like, it had to be overwhelming, no?
Yeah, it was way overwhelming. I think I was just, I don't know. I applied to 3 schools, and I
was wondering. That was my question. Like, how many did you even apply to? I don't know.
I applied to 3. I got I got rejected from Florida, got into Miami, and got into Florida State. Chose Florida State, closer to home. Knew about it. But in retrospect, I don't think I was wanting to be a maverick and fight that uphill battle. I don't think I realized it was going to come. That was what was going to happen. What I was going to have to deal with. I was just happy to get in and realized I should have broadened my net out a little, but it worked out. So, but yeah, it was very daunting. Trying to negotiate those, being a maverick, swimming uphill, or climbing uphill, swimming upstream rather, and mixing my metaphors there, swimming upstream, and at the same time trying to learn this massive amount of information, download that.
Yeah. So tell me, I haven't been to medical school. I have a doctorate in chiropractic and I have the master's in nursing, but I have not been to medical school. So tell me, I was thinking about this, like that sort of juxtaposition between my doctorate in chiropractic, and I know what that was from a surrounding of my peers and how the overarching, not the diving into the specific sciences in the classes, but like what was the health atmosphere of med school? What was the health atmosphere of you and your classmates, of your professors, of your staff? Like, was it all just like you got to learn this patho and this physiology and this biology, or were there broader themes discussed? Like, give us some insight into that.
Yeah, there were some, in the sense that at that time, and potentially still, the goal was to produce primary care physicians and to let them populate underserved areas in Florida. So to some degree, but like that's a really good question, actually, Jeff. Very insightful, but because it's more about how much you can learn, how much you can demonstrate you can learn. And I don't think that was ever intended or any in med school, but it just is the nature of probably any area of high achievement. And then proving that to other people. And you started at a young age, this almost masochistic, like, I'm going to study all night, every night. And oh, by the way, it doesn't matter what my personal health is, as long as I'm acquiring
That's what
knowledge.
I was interested.
And that's a very fascinating question, actually. And as long as I can learn how to take care of acute disease. Now, I don't recall. That's interesting. I know that there was an emphasis at the time on preventative health for the primary care provider's perspective. And so it wasn't that but I think for whatever reason, and there's probably a multitude of psychological aspects to that, but it was getting grades, acquiring this massive database of knowledge, and being able to get into especially beyond medical school, that you could, no matter what the cost was, whatever the personal cost was. And I don't recall. Yeah. Now we were at Florida State, and that's a big D1 school, and it's Florida. People are concerned about their appearance and health. So it wasn't that people weren't working out or weren't focused on nutrition to some degree, but I don't recall that class wide, even through the years, freshmen to senior medical students. I didn't find that there was a lot of emphasis put on mental health and physical health of the person who is learning to become a physician. You're very insightful.
I was thinking about that.
I wonder if that carries forward as you practice, right?
Yeah, I think about that, and I tell people a lot of times, and I wasn't exactly sure. This was my hunch when I asked that question. It was a little bit of a leading question. That was the answer I was expecting to a certain degree, and I started to think about that in chiropractic,
what was it like in chiropractic?
It was very different than that.
Really?
Yeah, I was thinking about that today as I was going to lead you down that question. I said to myself, like, I was introduced
the
to
next Joe Rogan here.
I was introduced to jiu-jitsu in chiropractic school by one of my classmates. Yeah, I was introduced to surfing at chiropractic school by one of my classmates. It was regularly discussed and regularly performed by the peers as an expectation that you would work out and exercise as a avenue to achievement of health. That was almost an understood aura of the school.
Let me interrupt you. Here's an interesting question. Consider this: is it those people that are going to naturally be interested in that get attracted to that? Correct. Or was it a part of the curriculum, or even in the origins of chiropractic itself, the fathers of chiropractic medicine, osteopathic medicine, those types of things?
Yeah, I would say it was not a part of the curriculum. I think it was a part of the ethos that drove a person to choose chiropractic education over maybe traditional allopathic medicine. If I'm honest, and I probably never said this to you, but I've said this to other people, the reason I went to chiropractic school and not medicine or not allopathic medical school is because you went to medical school.
Wait, say that again?
The reason I went to chiropractic school was because you went to medical school and I saw your experience.
Oh, really? Yeah, you never told me that.
And it wasn't for me. And I couldn't have at that time articulated what it was that wasn't for me, but it wasn't for me. I think
That's fascinating. I never knew that.
I think it was the overarching toll it took on you from that mass amount of acquiring this educational body at all costs to yourself that maybe when you're in the middle of you couldn't see, but I was.
Could you see it?
Yeah, I could see it.
Wow. Yeah. Really?
I could, and I don't know that I could have articulated it at the time, but I just understood and felt it, and so that's why I chose a different route.
So you were saying, no way am I doing that.
No, I'm not going there. It's just not for me. And I don't know if it was, like you said, it wasn't a specific curriculum thing. I just was like that, and I didn't understand it, but subconsciously that's the reason I decided. And I didn't really know a lot about chiropractic education. So I just knew that I wanted a different route, and so I chose a different doctorate program.
So a couple of things that are interesting that kind of come to mind for that is that, we were definitely open to osteopathic, naturopathic, chiropractic,
sure.
because we grew up that way, right?
For sure.
Okay, so mom and dad were both okay. So
but didn't reject allopathic care
to some degree, right?
Yeah, I guess maybe so. Okay. But more, I think, probably out of an income stratosphere, maybe out of a can-do attitude as I look at it, but also a little bit of, especially our father, maybe appreciated the alternative sides of some medicine.
But here's something interesting, right? You were saying you did it because you didn't go that route because I didn't, but you could have been a banker. You could have been so here's something interesting. Like, why did you go into the overarching world of medicine?
I tell people I just stayed in school long enough because I didn't know what I wanted to do with my life, and I woke up and I had a doctorate. That's honestly what I tell people. It's that's awesome. I started out with exercise science. I started out with business because I thought I loved business, and I realized I liked participating in business. I didn't like learning accounting, and I didn't like learning stats, and I didn't like learning. So I switched. I went to exercise physiology. I really liked exercise physiology because I liked performing exercise physiology. I liked the endeavors. I liked learning about that in the lab. Went on to get my master's in exercise physiology and was one semester away from graduating and had this like moment of like, holy crap, what am I going to do with this degree? You end up being a cardiac rehab specialist in a hospital. You end up doing stroke rehab. You end up writing protocols. And I was like, this is not what I signed up. I signed up because I loved it as a personal passion, but I definitely didn't want to have a career in it. And in my last semester of my master's for exercise physiology, I didn't tell any of my advisors of the school. I unenrolled from all my master's classes and enrolled in my last prerequisites for chiropractic school.
Holy cow.
I took those instead and then applied to chiropractic school. And so I don't have my master's in exercise physiology. I'm still that one semester short, but I used that semester because I didn't want to have to unenroll from school, re-enroll in a different program. I just signed up for these other programs, and it was a big enough institution that nobody realized it. Got my prereqs for chiropractic school and applied to chiropractic school.
Yeah. Wow, that was that practical side of you, that business said. So why would I waste time? Yeah,
yes,
that's fast. So here's something interesting. Golly, I mean, this is just so many themes and so many interesting topics here, because if you think about where we both came from, our parents didn't have college degrees. I think both of them kind of dabbled in night school a little bit, maybe after high school. And right behind me, you can see I've got the Jordan Peterson 12 Rules for Life. Right. And one of them says, pick something. I'm paraphrasing. Sorry, Jordan. This is Dr. Peterson. This is loose paraphrasing, but pick something and stick with it long enough to see what happens. So you did that. You pick something, and then stay with it long enough to see what happens. And look at that. I mean, that's pretty cool. And so the corollary is, you see people jumping from thing to thing. And, here we are at this age, right? 47, 45. We're like, them young whippersnappers today. Yes. So I feel like this curmudgeonly old guy, but there's some lessons there, right? I mean, this jumping from thing to thing and never sticking with something. I mean, you didn't really have that path forward so crystallized in your mind at the outset, but you stuck with it long enough. And look, I would say good things happen because of it.
For sure.
Would you agree?
Yeah, I think, if you ask me, did I find my passion and then follow that path? I would say no, I followed the path and then I ended up finding a passion.
Right.
And I just stuck with the path long enough. And just like, I think, circling back that conversation, your lit degree helped you significantly as a medical doctor. My path is all loosely tied, right? I have an exercise base in exercise science undergrad. I almost have an exercise physiology master's. I got my license as a massage therapist to put myself through through grad school. Those all helped me significantly as as a physician, as a chiropractic physician. I can distinctly remember my classmates and how they would approach a person and how they would approach a body with palpation, and thinking like, why are you doing it that way? That is the most ridiculous part. When they came from an undergrad degree of biology, they had never interviewed a person, they had never touched a body, they had never
Interesting.
palpated somebody. But I had been a massage therapist for 2 years through my master's, and I had worked with people as a personal trainer. I had worked on those interpersonal relationships, so it really, really helped me piggyback that into my nursing career. Having been a licensed chiropractor for almost 15 years before I went to nursing,
Right.
I was already to some degree competent with doing a health history. I was already competent.
You were a competent clinician,
Yes.
right?
Yeah. I just had to learn a new body of evidence and a new body of information, but the
Right.
clinical skills were there. And so it really paid dividends now as I'm practicing primarily as a nurse practitioner. So, yeah, that path, I think I would never have told you any number of years ago that I would be a nurse practitioner right now. And I would never have been able to tell you years ago that I've been a chiropractic physician, but all those have led to something else, and I just stuck to the path.
That's really cool, though. I mean, that's very fascinating. I guess this is why you do this. I didn't know.
This is why, yeah.
This is
So let's circle back. So you graduate FSU, you go through match. Is that correct? That's
Yeah.
that process, and then you end up at Wake Forest, correct?
Yeah. Yeah. So I
With a specialty of, what was that first one?
So general surgery.
Okay.
I did my internship at Wake Forest University Medical Center in Winston-Salem, North Carolina, in general surgery. Followed that up with, so you do your internship, then 4 years of residency.
Mm-hmm.
Then you kind of subspecialized, and that was rough. I like something like what you were saying, or similar to what you were saying. I always say maybe I wasn't the smartest, maybe I wasn't the quickest, the sharpest, the thing that I want to prize is being able to stick to something, and just plowing ahead. And found out that I had this passion for trauma surgery, surgical critical care. So I did a fellowship in trauma surgery and surgical critical care at Wake Forest. Loved that institution. It's an amazing institution. Like, there's lots of amazing institutions, but for me, loved it. And then at that time, there was this cool specialty that was arising out of a conversation in the Committee on Trauma, which is a subcommittee of the American College of Surgeons. And there was this, and it had been going for some time, there was this need for somebody to specialize. We were as surgeons, we were seeing this need for somebody to specialize in what is now called emergency general surgery. So it was a general surgery patient, and you think of general surgery as hernias, bad gallbladders, colon, gastrointestinal surgery, and things like that. But this was specifically people with serious acute surgical disease that needed immediate surgical attention outside the realm of trauma. And trauma, you could think of anything from somebody injured head to toe in a multi-system fashion during a car wreck, or, unfortunately, that part of our society, but violence,
Sure.
gun violence, and
So hold on, before you go further, help me understand this a little better. So there was a subspecialty that they were developing called emergency general surgery that was similar to, but a different etiology than maybe a traditional trauma surgeon. Would that be an accurate way of saying that?
Absolutely. So
maybe a non-violence onset of a ruptured X, Y, or Z, or
colon perforation.
Yes. Okay. But not stabbed in the stomach.
Right. Exactly.
But still equally as emergent.
Exactly.
Okay.
And so the surgical principles that guide trauma surgery and surgical critical care overlap nicely with emergency general surgery.
Mm-hmm.
Meanwhile, surgery and medical care in general, it's becoming, golly, we stand on the shoulders of giants in all fields, and it's just getting more and more. It was very difficult to be a jack of all trades because you're becoming a master of none. And so as the science progresses, it's very difficult for one person to do everything. And so you would see that these general surgeons were getting so good at herniaplasty or hernia surgery, or, elective type practices, breast surgery, elective general surgery things, that they either didn't have the time, maybe not the desire. Same time, surgical critical care was evolving as well. And so these elective general surgeons weren't up to speed on their critical care like we were. And so we were the natural folks to step in and take that role. And so I stayed a year and did that, loved it, left there to, again, start a new program. Is this theme,
tell me
right?
though, I think people don't understand truly what that means. Take me to a typical day in your last year at Wake Forest in surgery. You walk in at X time, you've slept X few hours. Just give somebody a snapshot of what that looks like.
Okay, so your first year, you've graduated surgical residency, you're ready to be a general surgeon, and you're learning the finer aspects of surgical critical care, ventilator management, sick people in the ICU on ventilators, life support, okay, and all that comes with that. So let's say on every Friday night, you'd be the quote unquote attending, like you're the big boss person, right? And you have the resident team and you're leading them. So you've rounded on patients. You start rounding at 5:30 in the morning. You're rounding on patients. You're seeing them throughout the day, seeing new admissions. People come in. There was a car wreck on Interstate 40. 3 people came in. You had to take somebody's spleen out that was ruptured. These people were all busted up. You bandage them up in the trauma bay, get them, find out their injuries, get them admitted to the hospital, take care of ones that you need to surgically intervene on, watch other ones, intubate somebody, meaning put a breathing tube in them.
Meanwhile, I'm sitting in my bed like, why hasn't Dr. Farrah come by my bed? He said he comes by and does rounds in the morning, right?
Right. And so
that sounds like
it's tough.
Probably what happens a lot, right?
Yeah, and you get called at there's no schedule to when you're going to have a car wreck, right? And so it can happen any hour of the day or night. And then you're doing your rounds throughout the day. It's getting towards the end of the quote unquote evening, 5 p.m. and you're ready for shift change. Although you're staying on, you've been there all day from 6 a.m. It's now 5. Let's say it's 6 p.m. It's 12 hours later. You're doing night shift. So there's a new set of residents come in, but you're the attending. So you're still there. Then somebody comes in. I distinctly remember this was my very first shift as an attending. Somebody comes in with acute neck pain, tachycardia, low blood pressure. They're septic, okay, and they just ate I think they had this woman had an esophagoscopy. Okay. She had an EGD, looking for, I forget, maybe it was reflux, and they needed to investigate what was going on. Anyway, unfortunately, what can happen is sometimes you can have a perforation. So somebody had a perforation in their upper esophagus, and so I had been operating all day, had been seeing patients in the ICU on the ward, the hospital ward, less sick than critically ill patients. And now someone comes in at 7 p.m. and has a perforated esophagus, sick as a human being can be, and I have to take him to the operating room immediately and open the neck surgically, find the esophagus, and repair the hole. And then that just continues throughout the night.
And then you have to go from saving someone's life in the middle of the end of a long day. Then you need to walk out and talk to her family and switch roles completely, right? That sounds tough, right? You go from like all hands on deck, I'm in control, this is a serious situation, do as you're told immediately, decisive action, to boom, in an instant, wind down, empathy, empathetic tones, let me talk to the family, let me comfort them, what may or may not have happened in the surgery room. That sounds quite difficult, to be honest with you.
Yeah, it's that adrenal gland is pumping overtime, right? And then you have to calm yourself, you have to refocus, but it's funny. It just becomes part of your daily routine, to where it's just what you do. You kind of, unfortunately or fortunately, you kind of compartmentalize, and you just get it done.
I'll tell you a story. I came to visit you in Ocala, and this was after you left Wake Forest. I in layman's terms, I called it your first real job when you went down to Ocala, and you instead of making $40,000 a year as an abused attending, you got a real job and you're working.
Full-fledged doctor.
Yeah, you were the big wig. So you said, I'm down at the ER or ED or whatever, and so I walked in there, and I remember this distinctly. I can feel the emotions coming back as I'm telling you the story. I walked in and I was immediately overwhelmed. immediately. It was, in layman's terms,
Sights and sounds and things like that.
the sights and sounds were overwhelming. There was people crying over what I perceive as a loved one. There were tubes and nurses and staff working on somebody else, and it seemed to be a chaotic situation. There was another situation where there was a gentleman all by himself. I remember him clearly. What I would describe as no signs of trauma, no signs of like a gory scene, but I could just sense how do I say this? A loss of life.
Of chaos. A loss of life.
No, just like this was not going to end well. I couldn't have told you anything about it, but there was just a
about
sense.
That patient?
Yeah, about that patient specifically. And I remember like my heart beating, my throat closing. And I was like, Jason, I got to go. I can't be in here. And you were like, what do you mean? I'm like, you need to look around you. And you were like, what? This is just another day. And I was like,
wow.
I can't handle this. And so I remember thinking like, dang, how do you do this? It needed to be Dr. Farrah Jason that they saw, not Dr. Farrah Jeff that they saw, because I would have been like, I'd have been in tears, I would have fallen apart, right? And if I wouldn't have been able to execute the plan and save the lives that could have been saved, because I would have been overwhelmed by the previous trauma, and I guess, I say couldn't have, I hadn't developed that skill, so maybe you could,
right.
But I remember thinking like, thank God it's Jason, not Jeff, that these patients are seeing, because like, it just makes me choked up now. It's such a traumatic event for me. I still remember that. And that was probably 10 years ago. And I was like, God, this is intense, man. This is intense.
Yeah. Amazing. Nick, again, I promise we did not pay him to.
But I think about like your current job. So like someone walks into your clinic and they're like, hey doc, I've got low libido. I'm fatigued. And can you help me? And I think about 10 people in the United States saying that same story, walking into 10 other doctors. And I think if I was going to go to somebody and they were going to give me something to fix that, I wouldn't want a fly-by-night telemedicine appointment with an online doc who used to be this or who got burned out here or fired there. If I'm going to step into a doctor's office, I mean, your pedigree to me is just like, there's nobody better, because you can say, well, I've seen really sick and X, Y, and Z, and I understand if those things were to happen to you, we could fix those, and I'll be able to recognize the signs and symptoms, right? Because I'm scared about the cardiovascular things that I've heard about testosterone. I'm scared about this, and you can speak educatedly about those things to somebody who's coming into you now, which equally to that person is an important issue, but medically in an emergency sense is a much smaller issue. But you have such a great pedigree that like there's nobody better. Who better than somebody who has such an exhaustive background in medicine to then now treat on this new embarkment. So I just think that's such a cool position that you have.
Oh, thank you. Yeah, I mean, I appreciate it. And I mean, again, I promise we haven't. Nobody's paid him to say anything. I really appreciate that. No, I guess I never thought about it to that degree. But yeah, I guess you become comfortable with the uncomfortable, and when somebody's walking through the door now at the clinic, yeah, I don't think those are daunting things, and I know I can help them.
Right.
And we'll get to the answer together, even if I don't have it. And it is a lot easier. Likewise, I've seen you do this a similar thing, and one of the cool things is, and we'll explore this in the next episode, hopefully, is about your origin story. But having that multidisciplinary approach and being there for people in all aspects of their care, even at the gym, what better way to have a medical practice than, hey, I'm going to be there through all parts of this journey with you, even to the point of the functional aspects of working out together and in helping you to develop strength and a kind of a coach mentality as well. And you're doing similar things, but yeah, I think that that definitely helps for sure.
Yeah, I just think like to circle all the way back, like your lit degree wasn't necessary, but probably gave you an edge in communication and empathy and understanding and grasp of the human language. Not something that a lot of people would say would use to describe their surgeon, right? Your surgical background gave you such an exhaustive body of evidence in medicine that it is probably making you such a great doctor in the wellness space, because I think a lot of knock on some of the wellness docs I hear peripherally is like, oh, well, you don't understand. You're not a real doctor. You're
Yeah.
just this. Or you're like, well, actually, would you like to talk about surgery and emergency surgery and gunshot wounds and stabs and
Yeah.
ICU care and ventilators? And we can talk about that too, because I did that for quite a long time. In
Right.
fact, I still do that. So do you think that your background from, or maybe speak more to that, your background from trauma and how it relates to wellness care and maybe some of the advantages or perspectives that it gives you now?
Yeah, that's a really good point. I'll tell you this: I don't think it's anything unique to me. I think it's unique to my experiences that I've had and that have molded me, and they would be to any surgeon. And the surgical training is so rigorous,
Mm-hmm.
and the way in which you, if anything happens to a patient, there's an old quote, and I don't know, medical doctors may not like this, but it was something like, if a bad outcome occurs on a medical ward, it's thought to be the byproduct and a part of the natural history of the disease process. And it was but if a bad outcome happened to a surgical patient, that outcome was laid at the feet of the attending. And so that personal
pressure.
That's right. And that personal, what does Jocko Willink call it? That radical, the word escapes me now, but just that the responsibility that you have. And so going through morbidity and mortality conferences or performance improvement regularly, having to answer for what you're doing, it's just the rigor of it, and being able to analyze literature, look at science and analyze it. And that absolutely has helped me with my wellness practice patients to a massive degree, to be able to explain them. I don't feel overwhelmed by the literature. I don't feel scared of the literature. I don't feel scared of contentious medical topics, testosterone, cardiovascular disease risk or not, how this fits
because testosterone is still probably a contentious topic, right?
Yeah, exactly. Unfortunately, absolutely. And so I can go into that arena and not be worried, not scared, and also be an advocate on behalf of the patient in a tough setting. And I feel confident that I can be safe with them and be careful with them and lead them through that. And that's helped me tremendously. Absolutely.
It's funny you should say that, because I tell people the same thing, but from a different perspective. I tell people, as someone prescribing testosterone frequently every day, seeing tons of patients, 25-year-olds with low testosterone, had a 30-year-old yesterday with a total testosterone male of 149, struggling for a long period of time, like 30 years old, right? No one would test his testosterone. No one would talk to him about it. But I say to people, like, I don't mind being an outlier. Listen, I've been a chiropractor for 15 years. My brother's a surgeon.
Yeah.
You can't tell me anything that will make me feel like an outsider more than it is to be a chiropractor and have a medical physician as a brother. I tell people too, when I remember used to say, people used to be like, "Oh, I'm sorry, I didn't mean to say like you're just a chiropractor," or they would like step on my toes. I'm like, "Listen, you have no idea, and you probably don't remember this, but I remember sitting around the kitchen table."
And the surgeon, right?
Yeah, I remember sitting around the kitchen table, and I'm going through school, and you were like, "Well, tell me about the adrenal glands. What hormones comes out of the anterior pituitary?" And I'm like, "Shit, Jason, we're having dinner here, man." But like, and I remember that. Yes, yes. And I remember, not to go down, an emotional story, but I remember when Dad was going through some of his trauma in that very first phase, when he went before he had his surgery, and we were talking, and the decisiveness with which you acted when Dad had that impaction, you were like, "No, we're doing this, and we're going right now." And I was in I was in chiropractic school at the time, and I was like, "Holy shit! Like, I better step my game up. I've got this I don't want to say a shadow, but I've got this pressure, that sort of that pressure you talked about with like, if anything goes wrong as a surgeon, it's lay at your feet. But if one of my patients dies as a general practitioner, it's just the natural process. But that pressure I felt from being your younger brother, watching you do these things. And I just remember being impressed with like, oh, he knows the literature. He knows how to articulate that literature. He knows the science, and he can transform that into action when needed with the patient. So I just remember that intense pressure, and I think that has helped me so much as somebody who, I think testosterone is contentious, but it's not. I don't want to make it sound like it's, we're getting bashed or anything. But a lot of people in the medical community don't believe in prescribing it, and so it doesn't bother
No.
me in the least. Like you said, you've had to dive into literature. You have a clear grasp of it. You can speak in an educated, articulate fashion in the language that general practitioner who may be questioning what you're doing. And so I think those things have led to, just like your trauma degree has led you to a better practitioner in this space. I think that same sense I feel from my background as well.
So is that so? One thing I would tell you, since you're giving me some compliments, thank you, is that I don't think there's any. I mean, I would challenge you, Tallahassee. I love you, Tallahassee. I remember growing up there, but I don't. So we grew up with a big exposure to naturopathy, osteopathy, chiropractic, alternative medicine, right? And
Mhm.
so I've been to plenty of chiropractors, and I've been to plenty of people that were in the kind of the fringes of medicine. And there's and this is because traditional allopathic medicine does not have all the answers. It just doesn't.
Mhm.
I mean, or people wouldn't be going to those people, right? I mean,
Correct.
it's just logic. What impressed me as I saw you grow through into the chiropractic provider and the medical provider as a nurse practitioner that you are today was I have never in my life been to a chiropractor that has the depth of knowledge that you have. I don't think I've ever told you this. Um, knows what they know, knows what they
Mhm.
don't know, because that's a lot of times which
It's a big one.
knowing what you don't know is incredibly important.
Mhm.
Um, so if I ever sent somebody to see you, I would feel 100% this person challenges themselves to be on the cutting edge of literature, to understand, has a certain expectation of themselves and their clinic, that we're going to be on the cutting edge of literature, cutting edge of medicine. We're going to know why we do what we do. We're going to have an in-depth knowledge of the body, how it functions, how it works. Your orthopedic knowledge base is massive. I've been impressed with that. And I don't know, just it's two standard deviations above what I've ever experienced in another chiropractic's office ever. And I always
Yeah.
wondered, and I'll ask you now, I always wondered, well, I don't know, was it his degree in exercise physiology, kinesiology? Was it that one class away from being a master's in exercise science?
Right.
Was it a personal attribute to that in his temperament, that he was going to hold himself to a standard of quality? Maybe I had some bearing on it. I don't know. What was it, Jeff? That I mean, because I'm going to just tell you right now, Tass, you're not going to go to a person who. Okay, so number one, you're never going to get any BS. You're a straight shooter, right? Would you agree? And you're gonna, you know what you know, you know what you don't know,
Sure.
and
Yeah.
it's just there's just this commitment to, I'm going to give you what you need, no more, no less. I know what you need. I know I can be confident about it, and I'm going to stay committed to the literature, understanding it. It's literally two standard deviations above what I've seen in other chiropractic and or wellness clinics.
Yeah,
I
I
just
appreciate that. I think probably from our upbringing, I think I had a strong, we had a pretty strong father figure, a dominant father figure, and there was this to tie it back to sort of like deep-seated sort of personal um perspectives. I think there was a strong, you had to be strong, and you had to show up in our house, or you would get lost, and some of that loss would come with some big bumps and bruises, and you had to hold your own, but you couldn't hold your own in a frivolous sense. You had to hold your own in a knowledgeable sense. You had to be present yourself in a physical sense. You had to present yourself in a mental sense. So I think it comes from a little bit of that. I think in chiropractic, I remember one of my professors saying, it's not knowing how to adjust that makes you a great chiropractor. It's knowing when not to adjust. And I didn't really understand at the
Wow.
time,
Wow.
but now it's like, yes, like I look at chiropractic and stroke. Let's talk about that topic.
That's a great one,
I've
Josh.
had a couple come in my office, strokes in progress, and I'm just like,
I
and
know.
then, and I've called you a couple times, and I've
Yeah.
known at the beginning, I was like, something's not right here. Couldn't have articulated, but I just knew X and Z and Y were off a little. Let me seek further. At later points, I've been able to kind of diagnose that in the progress. But when you look at the literature of chiropractic manipulation of the cervical spine and stroke incidents, it appears that it's not the chiropractor that's doing a bad job and hurting the patient from their adjustment. It's that chiropractors are not able to diagnose a stroke in progress. They become the last person to touch that person as a stroke in progress, and therefore they get blamed for it. The incidence rates among primary cares and chiropractors as a last physician to interact with a stroke in progress are the same. So it doesn't appear that chiropractic
Really?
manipulation of the cervical spine causes strokes. It's that chiropractors, as well as maybe general allopathic practitioners, are not good at diagnosing a stroke in progress.
Wow.
Patient A walks in and they have a splitting headache, and you're like, yeah, I've done headaches all my whole life. Let me just rack them and crack them, right? And you don't take the time to maybe do a full history, or maybe you're busy, or you just aren't good at finding the signs. And so, and then it worsens, it worsens, it worsens, it worsens. They go to the ER. Yes, I had just got an adjustment 3 days ago. Oh, it must have been that adjustment. In reality, they came to you with a stroke in progress. You missed the signs. So I think knowing when not to adjust and when was a motto that I kind of learned to practice by. I think something too in my chiropractic education specifically, I tell people I had to get really, really good at orthopedics. I had to get really, really good at orthopedic diagnosis because I had no tools that were broad enough to mask a misdiagnosis. Meaning, I couldn't give you a steroid shot
Oh,
for a rotator cuff that was actually a labral tear. But the
right.
rotator cuff, I mean, the steroid injection covered them both, right? I didn't
Right.
have those tools.
That's
I
interesting.
had tools that would only fix a rotator cuff if they applied to a rotator cuff, or a labral tear if they were applied to an actual labral tear. And so I had to know what I was doing. And I didn't have these, quite honestly, allopathic has some really powerful tools at diminishing pain in the moment. Steroid
Right.
injections, I'm just thinking of Toradol shots. It's something simple,
Right.
but are good at knocking down the pain. I didn't have those at my disposal, so I had to be really good at doing something else because I was not a wellness chiropractor. I wasn't someone who treated somebody 3 days a week just to have a better life or just to impart some. But I was an orthopedic chiropractor, so I had acute headaches. I had herniated discs. I had rotator cuff tears. I had labral tears. I had hip impingements. I had all these patients coming in, and I had to get really good at diagnosing them and treating them without tools at my disposal that a lot of orthopedists have at their disposal. And so it forced me to be good at those things if I wanted to treat the patient base that I set out to treat.
That's fascinating. Do you think it also, that plus the mindset of when not to adjust, did it
Mm,
make you not leery but discerning? When new information
yeah.
came your way, you were very discerning. Like, hold on, what now? Let me
Yeah,
let
it
me
didn't make me scared. I don't ever get
discerning.
scared. Yeah, and also I nenever got cocky because I always had that in the back of my head. I see this in some
Yes,
chiropractors. Are like,
yeah.
I
And docs
remember,
too.
yeah, I see. I remember a chiropractor in the local community where I was working at one point came to me. He's like, "Man, it's awesome. Do this technique and do this method and do this practice management, and you can treat cancer patients." And I was like, "Whoa, whoa, whoa, hold up," because I don't
Right,
remember ever talking about that. And I don't want to dive into the nuances of straight and mixer chiropractors and stuff like that. But I
yeah,
was like, that's not for me. I'm not qualified. I don't know the pathophysiology that you're talking
right,
about. And he was like, it doesn't matter. You're going to fix them anyway. And I was like, I'm going to stay away from that. Right. So
yeah.
I was like, I'm really good at what I'm doing. I love a herniated disc. I think I can treat a herniated disc now just as good as anybody in any side of the aisle. and I can, I can't cut on them, but I can tell you when they
Yeah.
need to be cut.
Right.
I can tell you when they don't need to be cut. And I have also found that patients who go through a round of conservative care and fail from a good qualified PT, chiro, manual practitioner who applies the solid practices and the solid methodology, but they still fail it, then they get the MRI and then they get the surgery. Those patients do better than the person who pain, surgery, because they may not have been a surgical patient to begin with.
Right.
Right. So you weed out the people who weren't good surgical candidates by going through this process, and the ones who weren't, they get better. And the ones who truly are surgical, they end up getting surgery, because I'm not going to hold on to them like, listen, I've tried my hardest. I've applied A, B, and C. These should have worked if this was the case. They're not working. I want you to see this surgeon. And I don't work in my practice with surgeons. I was discerning enough and astute in my town, my area of practice, that I could tell them which surgeons to go to and which surgeons not to go to, because I'm starting to see medicine is much more of an art than it has a lot of components of being an art more than a science. And I tell people, some people just aren't artists. You know what I mean? Like you want a good surgeon.
Yeah. No. Yeah. That's true. So, but to bring this full circle back into the wellness realm and in terms of vitality and the code, right? What is that thing that's going to keep us vital as we age? So I got to know, man, and maybe this can set up our next podcast as we're starting to run down on our time. What did you, that same discerning practitioner that you became, very carefully, intently listening to what was being asked of him, said to him, analyzing it, and then formulating your own independent thought. When I first came to you about testosterone therapy, what did you honestly think? Seriously. Because hey everybody, I want to take credit that I was the man that led him to the light. Led him to the light.
It's true. I was in Alabama. I had taken a sabbatical from my chiropractic practice.
Yeah,
I was in Alabama taking a sabbatical from my chiropractic practice to pursue my nurse practitioner. And you had started this journey without me, unbeknownst to me. I believe you were in Ocala at the time.
That's right.
And you were just very excited, and you wanted me to get my testosterone checked. I don't remember the details, but I got the labs done. I don't remember how I must have got them when I was home at some point.
Did you think I was being a kook? Did you think I was a kook, or was there a side of you that's, no, look, you were a former D1 athlete, played high level football. I was at the high school championship game when you caught the touchdown pass, high fiving dad. I mean, like, so you were, and I distinctly remember, because dad was a football nut, right?
Right.
We was trying to get you in. I mean, we lived in the same general neighborhood as Bobby Bowden, and remember the strength coach, and going to his house and getting the creatine powders and
the reason we were in Florida.
I know, right? So we were involved in high level, at least in a world that steroid abuse bumps up against, right? Let's just be honest. So I don't know. I never really asked you this, but I got to think. Were you like, dude, I know what that's like. I saw athletes get into that world. I don't want any of that. Or did that enter your mind at all? Number A, and then B was, look, what are you talking about? I'm fine. Do you think my testosterone's fine? Whatever, or none of that?
I think B. I don't think A. I never did any steroids. I never did anything through sports, through high school or college. I never did. I think I was just too scared, to be honest with you. I don't think it was like, I don't think it was anything more than just me being scared to go down that route.
You weren't some paragon of morality, right?
No, that wasn't that. I probably, if I had known how great they would have worked, maybe I would have.
Maybe this would be a different podcast too.
That's right. Yeah. No, I still don't think. I'm glad it was a decision I did, because I don't think they have such negative, such negative side effects. Absolutely. They're terrible. But I think it was B. I was like, what are you talking about, dude? I'm fine. I don't, because that's, again, tying back to our childhood. You were fine no matter what. You did the work. No matter what. You worked a 12-hour shift. There's a surgery. Okay, Jason, whatever. Get up and do the work. And that was the mentality that I had. And when you checked it, I want to say it was in the 200s.
Jeff, it was below 200.
Was it really?
Yes, I remember. It was, dude. It was like I was shocked because you were. I mean, again,
Do you
just
remember what you said to me? You like,
I
I
I I probably said you were probably had some big risk. Honestly, I
yeah,
don't.
I remember like thinking, and I didn't know anything about
Did I
testosterone.
say, "Are you menstruating or something?"
Yeah,
Were you so low?
well,
I don't know. What did I say?
well, I was the similar conversation, or the one before I had told you that we were pregnant with my third, Harlow, and you're like, well, I guess it's not that bad. It's Rob's working. So, but yeah, I don't. Even when you told me, looking back, I didn't know what that even meant. I remember the red. I thought it was in the 200s. You know, the LabCorp
You
results
as
are
I if
green and
I'm
red.
I could be wrong, but I remember you being like in the 140s, 150s,
Oh
160s.
gosh.
I mean, now thinking after all these years, I mean, are you shocked or that you were that low?
No, no, not
What?
knowing looking back at how I felt, I would say it was about a 2 year process. Um, and I distinctly remember, here's a couple things I remember. I remember going to jujitsu and I could do one roll. That was it. I could give you about 3 to 5 minutes. I probably couldn't finish that first roll. A 5 minute roll is a pretty standard one. I could do about 3 minutes of a roll and I was just gassed. The
Okay,
second roll of the
hold on.
class.
I'm gonna interrupt you. So for the audience, I don't know. Jeff has some crazy genetics. He was there's the movie White Man Can't Jump. Jeff was the white kid that could jump. I remember. Correct me if I'm wrong. He was like he had the high or one of the highest vertical jumps on the football team. I remember because Dad, of course, was going to brag and all that. The kid had for a typically slow white guy. He had a pretty good 40. He had a massive vertical jump. He had crazy squat numbers. Bench press was pretty good. I mean, this kid was a super strong, right? I mean, I'm for this little Christian school that we were in.
Sure, for a
Yeah.
small pond,
No
I
one,
held my own.
big fish in a small pond, but no one that you would ever think would have a low testosterone and getting
Sure, sure.
gassed. How old were you at that point? Where this was before 40 years old, right?
Oh, before
30,
40 for sure. I'm so bad with dates at this moment. Yeah, I was probably
mid to late 30s.
Yeah, mid to late 30s. And looking
Not getting
back,
gassed after one roll.
no,
Not this kid,
no.
right? I mean, yeah.
And couldn't do the second roll. I remember distinctly. I would just hold on and play defense. I would work on my defense, is what I was telling myself, because I just couldn't muster the strength to make aggression and make moves. And then on the way home, the first time ever. Now, a late bloomer in this world, but I stopped for an energy drink. I was like, I never,
never did that. Yeah, you
would
never
ever, right? I was like, I would pride myself, you sissies drinking those things, right? So I
Right.
stopped for a Monster. On the way home from jujitsu, it was like 7 o'clock. Yeah.
Oh, wow.
And so then I was like, oh, that kind of helped. Like I was able to because I was going home to kids. I had to be on, I had to still perform as a father. And so that would get me to bedtime. And then that progressed for a couple weeks. Quickly, I progressed to a Monster before jujitsu.
Really? I
to
didn't
get
even
me
know
through jujitsu, and then I would do a Monster after jujitsu to get me through my fatherhood duties. But it was such a creep of symptomology that
it was
I
insidious.
And my libido was down. Apathy would be a good word. I was going through school after working full time in a job and had a good background. So I don't, not to brag, but school wasn't like a super difficult thing at the moment, just given my place and time. I was in school, undergrad program, and I was near 40. And so I had a lot of free time, but I could barely make it to CrossFit. I could not get through jujitsu. And looking back, I had this 2 year window where I had nothing but school and time and only 2 kids, and I was like, man, I could have crushed it. I felt like
couldn't
garbage.
Capitalize on,
Could nothing. I felt like garbage. I feel better at 45 than I did in my mid 30s.
Wow.
For sure.
That's amazing. So when you got that, was there a reckoning in your mind where you had to say,
yes,
okay, I guess I got to do this? I mean,
yeah, it was my first medication ever. I was on 0 medications, and maybe at some point we'll go down my kidney issues. But other than those issues, I had never been on a medication, never taken an Adderall, never taken I didn't even take ibuprofen. I told Stacy the other day I never took a Tylenol till I was in my 30s. I
Oh
was
my
like,
gosh.
damn,
Jeez.
this stuff's amazing. You guys have had this for how long? Like, so, like, to me, it was almost a badge of honor. Like,
Yeah.
no, I'm not on any
It was though, wasn't
medications.
it? It was. It kind of was, right? I mean,
It was,
yeah.
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 And not that I looked down on other people, but I just thought I don't need that. I'm just doing. I'm good.
Yeah.
And now looking back, that last 2 years was probably just abysmal in terms of what I could have performed, from my mental clarity, what I could have performed as a father, how I could have performed. Testosterone has helped me in so many ways that it was just such a natural genesis for me to begin practicing. I don't remember.
Right. Right. Why would you not? Why would you not want to bring that to your patients, right? I mean,
Yes. And I don't remember the first shot or anything like that. I remember you prescribing it. I remember us talking about it. I remember how it went. But I remember,
did you do
like,
injections first or
I did
pellets?
injections first. I did injections
I
first.
thought, I thought so. Oh, and
And
then you
we
kind of estrogen was a little bit of a problem.
Yeah, estrogen's a big
Version
problem
of
for
estrogen.
me, which is
Yeah.
a estrogen control and testosterone therapy makes or breaks a guy's experience. And if it's not
Gosh,
done well,
well articulated.
yeah, it's not the testosterone that makes or breaks it, in my opinion. It can be done well, but what makes or breaks a testosterone replacement regimen is the doctor's ability to effectively control the estrogen and how it affects a patient.
Excellent.
And I was a huge estrogen converter, and so we switched to pellets.
Yeah.
And looking back, I tell people, this is what I tell my patients: it shouldn't be a nuanced effect, and I see this in my practice every day. It should be a 180-degree change. You should not have to question whether or not it's working. I tell
Right.
patients, if you're
Right.
questioning whether it's working or not, you know the answer, and the answer is it's not working. You
Right.
just maybe want an answer. You should come in and you should be like, hey, I told 3 of my buddies this is the best thing, they should try it. Not because of some silly notion that it builds muscle, not because of some silly notion that it's abusive or addictive, because it
Right.
makes you a better dad, because it makes you a better
It
employer,
does.
it makes you a better employee, it makes your cognitive recall, it makes you back to all. If it's low, if your testosterone is low, replacing
Truly
your
low.
testosterone
Right.
makes those things. If your testosterone is not
100%.
low, guess what? It doesn't work.
Right. Right.
It'll put on
Lost.
3 to 5 pounds of muscle, but who cares about that at 40?
Right.
You're not going to win Mr. Olympia on testosterone
Right.
replacement.
Right.
If your testosterone is truly low, taking testosterone fixes those issues, and it's life-changing.
To me, when you get on testosterone therapy and you were hypogonadic and had a low testosterone, and then you become eugonadic and you're or optimized, it's like going from black and white, living in black and white, to Technicolor. Would you agree?
For sure.
I mean,
I would agree.
I have
Yeah.
no qualm saying that because I've just seen it over and over. And by the way, both men and women.
Men and women, for sure. And here's the thing I tell my patients and I tell doctors when I'm training them, I think doctors are scared of testosterone, but if I spin it this way, it's almost like, oh, that makes it easy, right? It is self-limiting because nobody will go through what it takes to do testosterone replacement if they aren't low, because it doesn't give them any benefit. The only small benefit it gives them is muscle growth, and nobody's willing to go through it. So it is self-limiting. The people who don't need it steer off of it, except for that maybe that 1%. And then the people who really need it tell 5 other people, and that builds your practice, and it changes their life. And so, and it
literally
segues.
changes their life.
Yeah. I think I like testosterone because of its bang for your buck. I tell people I love medical endeavors, health endeavors that have a large halo effect, right? Now your testosterone is optimized and you feel really good, and you're like, well, I've got this new thing. I should also go to the gym. I'm also going to the gym. I probably should not waste that. I should probably eat right. So I see this time and time again. Starting testosterone therapy actually leads people to getting back at the gym. It also leads people to eating correctly, because you're doing 1 and you're feeling so good. Well, I don't want to waste that. Let me do 2 and let me do 3. And so you end up getting this large halo effect. And so a lot of the things in my practice that I've set out to offer to patients have a large halo effect.
Yeah, and
I think testosterone is that.
And it's, yeah, I agree with that 100%. Another thing I've seen with testosterone therapy is the chicken and the egg. So someone comes in, they're like, yeah, I know I should be working out. And hey, I know I'm not a dummy. I've read, I know if I start building up large muscle groups with resistance training, my quads, my
Mm-hmm.
buttocks, my chest. I may
Mm-hmm.
be able to, and if I changed my diet, there's some other things. I've listened to, the Huberman podcast. I know some things I can
Sure.
naturally do, but I just don't feel like going to the gym. And I
Right.
feel like crap because I don't, and I feel guilty because I don't. And I say, hold on, I get it, and maybe we could power through some things and whatever. But the funny thing about testosterone is it's the chicken and the egg. Like,
Right.
You optimize the testosterone, you change the neurochemistry, the synapses. You got there's dopamine, blah blah blah. We'll talk about this on another podcast. But all of a sudden, this motivation to
Mm-hmm.
in animals we say motivation to forage. In adults, you have this motivation to take on tasks and
Right.
mental
I
clarity.
had a patient tell me
energy.
a really cool way. He said it makes hard things fun. I think he
Yes,
may have heard that from a Huberman podcast, maybe,
yes,
but I
yes.
hadn't heard that podcast, and I was like, oh, it does.
It does.
It kind of does
And now
make
all of a sudden I
difficult
want to
things
go in the
fun.
gym. And by the way,
Mm-hmm.
now I'm seeing results. I didn't see
Mm-hmm.
results before, and I'm like, yeah, that's the key. That's the key. And so it's self propagating too. I mean,
Yeah.
not only does it have a halo effect, not only does it solve the chicken and the egg dilemma, it's self propagating. I mean,
Yeah.
and so now, just to kind of come full circle and maybe wrap this up, what was your experience once you got to a steady state of testosterone, and how was it different than you have been living? I mean, clearly we said it's black and white in
Yeah.
color. I mean, what kind of things were you seeing more endurance in jiu-jitsu? Did you see your relationship
I
with your
wish
wife
I'd
and
started
kids?
2 years earlier.
Yeah.
I call it, this is my, you could call it the Jeff Farrah test. I call it the trampoline test. If I will get on the trampoline at 7:00 at night and jump with my kids, I know my testosterone's right. It's true.
Yeah.
It makes me a better dad. When it's not, I'm just like, my God, I will set fire to that trampoline right now, right? I've been jumping on that trampoline. My kids are 6 years apart. I've been jumping on that trampoline for 15 years. You want it right now because it's only 10 minutes, but you're 16 years. That
Yeah.
right? But when my testosterone is optimized, I'm like, let's do it, buddy. Let's bounce. Let's go.
Yeah.
Right?
Yeah.
So that has such a downstream effect for me. Honestly, if it did what it does for the gym, which is really cool and really great, side effect, it's what it does for me in my office. It's what it does for me as a parent. It's what it does for me as a spouse that keeps me on testosterone.
Yeah.
100%. 100%. I just am in a better mood. My mood calmed down. Like my fuse was getting a little short because I felt kind of crappy inside and I couldn't perform like I wanted to. I was tired all the time. My fuse started getting short, started getting grumpy, and I'm not. I'm just like super chill.
So Jeff, you didn't have roid rage when you started testosterone?
I did have roid rage, right? Yeah, that's such a silly thing. I still hear that from doctors.
Yeah, well, I mean, it's an interesting thing because now, truly, we can say that synthetic anabolic steroids.
Correct.
Roid rage is real, but it's not the testosterone gives you roid rage. Maybe things that are more androgenic.
Synthetics that are correct. Right. Testosterone derivatives, synthetic testosterone derivatives.
That are highly 100%. Androgenic, especially compared to testosterone.
Sure.
And you're at levels that are, of abuse.
I see it all the time. Yeah. I tell patients, don't mess with it. You're dumb. You're taking one of the smallest benefits of testosterone and you're trying to expand it, i.e.
exactly.
i.e. muscle gains, and you're getting all this negative. Why not take this testosterone and get gains across all these modalities?
Right.
Silly to do
at
those
safe levels that are naturally occurring.
Yep.
And
I have these open conversations. Yeah, I have these open conversations with my patients because I've never prescribed any of those synthetics, and I feel like I've educated enough guys and gotten enough guys off those that it is worth it to me to have those conversations and be an open book and not judge them, but educate them as like, hey man, like, yes, it gives you this narrow, potentially deep thing that seems important to you now when you're 25, but it's going to wreck this. It's going to wreck that. It's going to wreck this. Let's pull all that back safely, nicely. Don't cold turkey it. Let's slowly bring you back down to a natural state. Let's see how your testosterone is. If you need it, we'll cross that bridge. If you don't, let's wait till you do.
Yeah. I agree. Cool. Well, so I think we should probably start to wrap it up here.
We should. Nick's going to be, our producer's going to be like, hey guys, this is not a 7-hour podcast, right?
I don't have all day. So hey, next time let's delve into your story a little bit if we can do that. I want to do that. Great. I want to and I think let's explore this topic of testosterone a little bit more too.
I think so. I think testosterone in females, we didn't really get down to that. That's a great topic. I see that
absolutely
a lot. So let's do that. Maybe some of the specifics of testosterone and testosterone replacement, since we're both practicing that pretty heavily in our practices.
Awesome. Sounds good, man. Look forward to it.
All right, Doc. Good talking with you, brother.
See you, man.
See you, brother.
Bye.